Assalamu alaikum, welcome back to the episode. In today's episode, we're just basically recapping on some of the topics that we touched upon in the previous sessions, particularly around understanding mental health and well-being, particularly around how we understand and how we manage these issues around anxiety, panic, bipolar disorder, depression, and so forth. And I was, before the break, I was actually halfway through a question, and the question was actually, I spend a lot of time, somebody's asked that, I spend a lot of time looking for tablets and vitamin supplements and things like that. And this particular person who sent in the question was talking about how she feels that she's constantly running from tablet to tablet, but doesn't seem to feel the benefit of those tablets, doesn't seem to feel that they're actually having any effect. And before the break, I was just briefly mentioning that actually to the person that sent in that question is you need to go first check that you actually need those vitamins, and that can be easily done by going to your GP or health practitioner and asking for a blood test, asking for an overall health assessment. Because I think one of the things that we all do when we're faced with difficulties or challenges, when we're not well, is we want to know what it is, and we want the solution straight away, and we want to resolve the problem straight away. And because of that, we sort of then rush from one thing to another. We'll rush to get advice from some people, and then when that doesn't work, we'll rush to another person, and so forth, without actually stopping and thinking about what is actually happening. Now, for mental health and well-being, one of the biggest things is, before the break, I tried to give a very potted history or a potted example of how we manage or understand things. And what you got to remember is if you stick to understanding three components: any issue or challenge, how it makes me think, how it makes me feel, and what it does to my body and how I react to that. Okay, so how it makes me think, how it makes me feel, and what I do to it, what I do with that within my body and externally within my environment. And if you think about any challenges or any issues that you face, and you think about those three things, so what am I thinking about? Are those thoughts right, or are they appropriate? Are they wrong? And then actually, how is it making me feel? Is it making me feel angry, sad? And what is the emotion that I'm feeling? Where is this emotion coming from? And also thinking about what am I doing? Am I doing things to make it worse? Am I doing things to help it get better? Am I avoiding things? And what is my body doing? What are the chemicals running through my body, and how am I managing those chemicals? So any sort of issue you think about, if you think about those three areas, and then try to slowly break those three areas down with a professional, hopefully you'll be able to get an better understanding, but also be able to manage the difficulty in a better way, hopefully. I think if I've got a couple of slides actually, which will hopefully help our viewers understand things better and have a visual. So looking at this slide that I've got, I wanted to show to our viewers the different things that affect how we feel and how we think about the world around us, and how we sort of make assumptions about the world around us. Okay, so a bit like what I was just talking about, the things that affect us. If you look at the screen, and you'll see a diagram on the right that's looking at the individual in a round circle, and then you've got the psychological, so what we're thinking, what we're feeling, and our emotional side, and the biological, what our bodies are doing. The social side, I suppose, is also thinking about our environment. I'm reminded of a story of the Prophet ﷺ who once, it was narrated to the near meaning of Hanzla radiallahu anhu, who was, crying in the masjid one day, and Abu Bakr radiallahu anhu came and said, why are you crying? And Hanzla radiallahu anhu goes that I'm crying because actually I feel that I've betrayed my iman. When I'm with the Prophet ﷺ, I can see Jannah and Jahannam. I can feel my iman being very strong. when I'm not there, I feel really weak and I feel that I'm a hypocrite. And Abu Bakr radiallahu anhu started crying as well. And actually what this hadith, what this story told us, when both of them went to the Prophet ﷺ, the Prophet ﷺ said, only angels' iman is constant. Ours as human beings, our iman, our understanding, our feelings, our value systems are constantly changing. And I sometimes use this example specifically when I'm working with Muslim clients, to show to them that actually our religion, our understanding of the deen around us, actually it was already pointing to these elements of understanding how our bodies were coping, how psychologically we're thinking about things, and importantly how our environment was shaping our thoughts. So the people that are around us. So if you think about what Hanzala radiallahu anhu was saying, he was saying that actually when he's with the Prophet ﷺ, when he's in the company of the Sahaba radiallahu ajma'een, when he's in the company of pious people, you know, his iman is boosted, his well-being is boosted, his fikr is boosted and what have you. But when he's out of that environment, you know, his iman goes down and what have you, because man is forgetful and we get sidelined. That doesn't mean that we should, you know, not fulfill our duties in other areas. It means that we have to understand what is happening, and it points to an issue that our iman, our understanding will change, our emotions will change. And when you think about it that way, it's telling us that actually the Prophet ﷺ was telling us how our thought process also dictates how our bodies react. And it's telling us how we can actually resolve that by actually spending time in the company of pious people, by actually reflecting, by taking that time out, and by developing strategies, that will help us rather than hinder us. If you look on the left-hand side of the slide, the slide actually shows on the left-hand side different elements and different factors that can affect us and our identity of who we are. You know, our family, our backgrounds, our economic backgrounds, our religious belief, and all these things affect who we are and how we cope with things. So as a professional, you know, we've heard myself and Dr. Ahmed on many occasions say, when we've received questions, actually we need to know more about your life. We need to know more about how you cope with different things, how you respond to different things. And this is what this is about, because your life is complicated. Everyone's life is complicated and complex. And one of the things is, for us to understand this, is to get an idea of who makes up your life, who is important to you. So it's important for us to understand that, and it's important for you to understand that, because if you're trying to manage and if you're trying to understand the issues that you're facing, then actually understanding who is in your life and who is going to actually support you through it is going to be important, and how you manage that. So if you know that somebody is not good in your life, or is not helping your mental health, or the bad behavior is not helping, so then if you understand that, then you move away from that. That will automatically help you. Or for instance, if you know that you're not sleeping at night, you're playing computer games, or you're watching TV, or you know, you're doing other things that are draining your life of sleep, and you know that's not helping, then it's important to think about how you can adjust that, and how, inshallah, you can sort of challenge those issues that you're facing. One of the other questions I've received is, it's slightly complicated, and I'm not sure 100% I can answer this, so I do apologize from the onset to the person that sent me this in, because again, the fundamental issue is I don't have enough information, so it wouldn't be appropriate to give you basic, you know, advice or anything like that. But the question is, my son has, after his exams, stopped eating, stopped talking, stopped going out, and stopped socializing. You know, he just locks himself in the room and has become very isolated and very grumpy, and I do not know how to relate to him. I do not know how to help him. You know, again, I'm not sure what that is about. I don't have enough information. But what I would recommend straight away is, go to your GP, even though it's about your son. You can go to your GP. You can tell them about this. Tell them how you're feeling about this. There are information out there that you can get for your son who's facing these challenges, and recommend that he tries to talk to somebody. With regards to your relationship with your son, I think one of the things is, like I was talking about in the previous question, one of the biggest issues is communication. And sometimes we find it very difficult to communicate. Sometimes we communicate, when we communicate and when we're talking, we're not actually listening anymore. So one of the biggest things I would recommend to you is, without actually having any information about this, is to try to listen to what your son's saying. Because he will be probably talking to you at different times, at different levels, and not to get annoyed and not to shout, or to remain calm in that situation. Because I think your son is going through some challenges himself, and I think he'll probably need that support for you to be understanding, and offer that understanding. Say, actually, what do you need? Rather than saying, look, you need to do this, this and this. What do you need? What can I get you that'll help you? And creating that space and that environment. Without any further information, it's very difficult to answer that question. When I think, just going back to another slide I'd like to show people, when something happens to our natural ability to cope and manage in our lives, I've just listed here again, some of the things I've just been quickly talking about, and this is how sometimes our bodies react and how we react to the issues we face. So for instance, like I've mentioned before, our thinking changes, feeling and behavior changes, our motivation and our drive can change, our understanding, our concentration and our focus changes. And when these things change, our body systems may change. We may sleep more or sleep less, eat less or eat more, gain weight or lose weight. So a lot of people, depending on what the issue is, start to gain a lot of weight. So for instance, I have a client recently who sort of became very, very upset and very sad and very depressed and very anxious, but actually didn't realize that the way he was managing his anxiety and sadness was that he was constantly eating. Every hour or so he'd be just eating, and sooner or later he'd work through a whole pizza on his own self. And I think what he realized afterwards, when he sort of became very ill, was that he, throughout the day, for 10 hours he'd be just constantly eating, and then not moving around, and that would be making him more depressed and anxious, thinking that I've got no energy. Even though he's eating so much food, that food wasn't actually being utilized as energy, it was actually just being stored as fat. And so that actually impacted more on his mental health, physical health, and he became more depressed and more anxious. So that's actually quite a nice example of how sometimes eating too much or even eating less can spiral out of control. And sometimes what will happen is we will start to eat, for this particular individual, because he was so upset about something that had happened to him, he just constantly kept eating. But because he didn't realize he was eating, because he'd be sitting in front of the TV, he'd be eating, he'd be reading a book, or he'd be trying to read a book, he'd be eating, or he'd be texting on the phone, he'd be eating, excuse me, and he didn't realize that he was actually eating. So one of the ways that we can sort of break that cycle is trying to build routine in our lives. It's trying to build routine in our lives, trying to get up. If you're sleeping in too much, setting an alarm in the morning, setting it for Muslims, mashallah, setting it for Fajr, making that intention to get up for Fajr. And for a lot of people, actually, the namazes are a good way of establishing routine in your life. You'll get spiritual benefit, religious benefit, but also practical benefit, because your day will be run through the namazes. So for instance, if you're sleeping constantly in the morning or you're feeling really tired, but if you make that intention for Fajr, you slowly build it up. Sometimes you might be able to do it, sometimes you might not. But making that intention in itself is actually a first step. And when you do that, when you build that routine, actually you'll realize that actually I can break out of this cycle that I've got myself into. So with this particular individual, actually, once he realized that how ill he'd got physically and mentally, one of the things that we tried to help him with is build that routine in his life. So he would only eat at specific times. Instead of eating in front of the TV, he would eat in the kitchen on the dining table. He would eat, and his portion sizes were limited, and thinking about what those portion sizes. So rather than eating really fast, he would slow down his eating, and he'll think about what he's actually eating, and he'll savor the taste of what he's eating, and then he'll make a menu plan. He'll make a menu plan of actually what he wants to eat, and doing things like that will help us construct a way out of our issues, will help us construct practical ways in which we can challenge the anxiety or the depression or the phobia or whatever challenge we face, and whatever symptoms that we're feeling and everything. It's about building from the small things, and this is why it's important going to a professional, and that professional can help you construct a doable timetable in which that challenge can come. I mean, some of the questions, going to my next slide, some of the questions people have sometimes, which we've also touched upon on this slide, is, will I ever get better? Now, I'm always asked that, will I ever get better? And I said, well, you know, a lot of people actually, not only do they get better, they actually open another level of understanding. And what I mean by that is yes, mental illness, health problems are difficult and they're challenging, but actually they open up another level of understanding. And what I mean by that is it gives you an appreciation, it gives you gratitude, and it makes you feel gratitude that Allah subhanahu wa ta'ala has brought you through that, but also given you an idea of what potentially other people are going through as well. And what I always say to people is not only will you get better, if inshallah you stick with the routines and things like that, and the guidance and the determination of yourself, you will get better, or you will manage it better, because some issues are not so easily movable, depending on when you've sought help and where you've sought help. Some issues take a lot longer to deal with, some issues can get better very quickly, and because every individual is unique, they need unique sort of intervention. That may be medication, that may be therapy, that may be, support, physical therapy, that may be going out and exposure work and so forth. So it will take a long time. Sometimes it may take a short time. It may take, you might be living with it for the rest of your life, but it's about managing it. It's about understanding it, and it's about managing it. And not only will you get better with it, but also hopefully inshallah your understanding will expand as well. The other question sometimes people ask is, am I alone? Am I the only one? Why am I the only one feeling this? Why am I the only one feeling this? And first and foremost, it's a big shock to people when they realize actually they're not the only ones feeling this. It's not just them that are feeling this issue. It's not just them who are struggling with this issue. And I think it's important to know that every individual, I said this at the beginning of the program, every individual, no matter who they are, no matter where they are, every one of us feels a level of mental ill health, and it's a question of how we manage it, and it's a question of how we deal with it. Another question we keep getting asked is, the doctor just wants to give me medication. Is medication bad? Is it good? Do I have to take it? What are the side effects? First and foremost, doctors will only give you medication if it's necessary and if it's appropriate. And if it's a good doctor, they will explain to you the issues that will come from it. And if they don't explain to you, actually ask that question. Ask that question from the doctor to say, hang on a minute, you've not explained to me what this medication will do, how it will work. So a lot of people, when they come to my clinic, or I know Dr. Ahmad's clinic, and some of the other doctors, they will explain to you, actually, this is what this medication does, this is why we're giving it to you, and we're thinking this will help you in this way, but it might not. Because actually, when a doctor gives you medication, they're trying to work out whether it will benefit you 100% or not. And it is about finding what is best for you. Because sometimes some people say, well, how can that person be on 600 milligrams of this medication when I'm only on 50 milligrams of this medication? Or why can't I have more? Why can't I have less? And the reason behind that is do speak to a pharmacist. I'm not a pharmacist. Do speak to a pharmacist for more information. But each person, the doctor is testing the medication for each person and what that person can tolerate, what is best for that person. So that's why you might have different doses. And it's not always the case that the higher the dose, the better effect it's going to be. Actually, no, sometimes it's the opposite. So it's about talking with your health professional, that why are you giving me medication? Why have you recommended this? And what does this do? And how will this help me? I think there are cases where medication is needed if there's a biological, how our body's coping with it, how our hormones are coping with it, and there is a need for it there, and it helps us manage. But medication is not the only solution, and it's not the only sort of avenue that you can look at. It's one of the main avenues that is used, but a lot of talking therapies, i.e. psychology and all these things are used as well. And I think from all the episodes that we've done, we've always sort of reiterated that actually please do seek advice and help, whether it be from a health professional or your GP or somebody from the nurses or anything like that, but do seek advice. I think with all the issues that we face, first and foremost, for Muslims, our yaqeen is that Allah subhanahu wa ta'ala is there. Never lose hope. Never lose hope. No matter what challenge or issue you are going through, Allah subhanahu wa ta'ala is there. And this is one of the biggest things for Muslims, that as medical professionals we can say, inshallah. That's the end of our program. I'd like to just finish by thanking the viewers for watching the show and everything. Hopefully, please do keep sending in your questions, and inshallah we'll be back with another episode of the Medical. Wassalamu alaikum wa rahmatullahi wa barakatuh.